to make the community of medical training not so toxic. That's mostly my work through Improve Medical Culture. So just to clarify, Improve Life is my clinic, and Improve Medical Culture is mostly focusing on teaching and like literally improving medical culture. It's a very descriptive, accurate name. So it's just basically trying to prevent hazing and harassment and abuse and fostering like a more warm and caring environment in medical training. So that is that organization. Okay, so next, it seems that I have a degree in psychology. Yep. And biology. Yep. And medicine. Yep, that's right. So Miriam has been doing a good job on her research of me. Miriam is my office manager, by the way, and she usually makes my presentations. Of course, I read over it, but yeah, she knows a lot about me. 17 years of experience working in the mental health field. Gosh, has it been that long? Okay, so I do specialize in perinatal psychopharmacology. Now just like breaking down words, does anybody want to take a guess as to what that means? And just take it apart one by one and see if you can come up with what it is. And you guys all look very tiny. So you guys look very tiny to me, so I can't really see if anybody's raising their hand. Well, is anybody raising their hand? Is there a hand raised? Come on, break down perinatal psychopharmacology and tell me your name before you start.
Hi, can you hear me?
Yeah.
Okay, my name is Olivia.
Hi, Olivia.
So for perinatal psychopharmacology, for perinatal, I'm thinking involving birth or to be born. Peri, I wasn't sure, but then I was like, maybe like perimeter, so like around, so something around or involving birth. And then psychopharmacology, ology, study, pharmaceuticals.
Sorry, you're breaking up a little bit. Yeah, I heard the peri, which is around, and the natal, which is pregnancy, but what was the part you said? It's not that I can't hear you, it's just that it's breaking up. Your voice projection and volume is terrific.
Thank you. The psychopharmacology, just around the like, I guess medications or like the study of medications in brain, maybe.
Oh yeah, you all of that was exactly right. Yay! Hey, yeah. Yeah, so psychiatric medication in the pregnant postpartum population. Exactly. I knew you guys could do it. And then geriatric medicine. Who knows what geriatrics is?
Elderly population.
Yeah. So, I used to work in elderly populations in the inpatient and hospital. Oh, outpatient. So outpatient's just like clinics, and inpatient is hospital. Yeah, that's back in Pittsburgh. Woo, that would have been about 20 years ago. Holy moly. A neuropsych intern. Yeah, I did that at Allegheny General. I did evaluations on a lot of head trauma patients. It was a very interesting internship for me. And then as a medic for the Coast Guard, that was a fun time. And then I also did some similar medicine with the Civil Aviation Authority. So that would be like flight medicine similar to the Coast Guard, only it was in the United Kingdom. I think that's a couple pages from now, actually. And then mental health professional for United Planet. So I worked with the mentally and physically disabled in Japan. A long ago. Oh, and now I think that's it for this slide. So you can go to the next slide, which is pictures of me and my kids, which I mean, yeah, there's going to be a test on this later. So you guys need to identify. No, I'm just kidding. So yeah, momming is like my main thing. So, maybe some of you have questions about like family and balancing career and stuff like that. I will be perfectly honest. When doing all the warm up and ramp up to undergrad and grad school, and then med school, and then internship and residency, and all of that, like I was very focused on my career, and I guess it was just in the back of my mind, like, hey, maybe one day, like, I'll be a mom, but it wasn't like there are just some people that are like, what do you want to be when you grow up? I want to be a mom. That wasn't me. I was very, very career focused, and but then I became a mom and everything changed, and I was like, oh, okay, like this is actually now my number one priority. So I suppose I'm saying this because throughout your life your priorities might change. And so here we are, me, pictures of me being a doctor and pictures of me being a mom. And my kids do come to like networking events and stuff. It's a family business, you know, they come and they help me. So we can go to the next slide. You guys might notice some people that you recognize in these photos. Do you guys recognize any of these people?
Yes.
Okay, I like the participation. Let's elaborate.
Who do you recognize?
It's
Me. Yes.
all.
Thank you.
Okay, yeah, so celebrity cameos are making an appearance there. Um, so as I said, Improve Life is my practice. We have locations in Reston and Ashburn. You could really be seen from anywhere, depending on what you need to be seen for, due to the birth of telemedicine that was one silver lining of COVID. And then these are some pictures from some of the teaching and events that we have. And all right, let's go to the next. Ooh, career overview. Okay. All right, I think we can I think I could do a little summary of this for you. So let's see. Compassionate care and fostering a supportive environment. Yeah, so improved medical culture, like I said before, is like really self-explanatory. Like it's more of medical training, but honestly, like even with patients, so there's some toxicity and just some really unfortunate things that happen in the healthcare system. And I mean, it's a big undertaking to take them all on at once, just like one thing at a time. So I hosted a National Day to Prevent Physician and Med Student Suicide, which is not to be confused with physician assisted suicide, because I very strangely noticed like people protesting my movement, and I'm like, why would you want physicians to take their own lives? And they're like, oh, we thought that this was physician assisted suicide. And I was like, no, then no. This movement was to prevent med students and doctors from taking their own lives. It's a very different concept than physician assisted suicide. That's something completely different. So I'm a big advocate for mental health care for doctors and med students and residents, but it is an obstacle because there can be negative repercussions. Doctors going to get mental health treatment because like when they go to get jobs or renew licenses and stuff, like they might be asked about, have you got mental health care? And that just like creates a barrier. People don't want to go get help because they're afraid it'll come back to bite them later on. So that's one of the focuses there. And it is said that the profession with the highest suicide rate is being a physician. I mean, there's a lot of stress that we have to deal with, and we deal with life or death every day almost. So it's pretty intense, but we're working on it. And then I was filmed for the movie Do No Harm. So the film crew from oh, that HGTV show where they have the three houses and then the people pick one, but you know it's like staged. House Hunters, yes. The film crew from House Hunters came to my house to film me for a weekend. And it was for the Do No Harm film. And then it's basically focusing on like all the abuse that happens during the medical training. I don't mean to discourage any of you guys. I think that it's gotten better since back in my day. But if you do encounter any sort of toxicity or abuse in your medical training, know that we're not all like that, and definitely like working to help that. And then I spoke for Public Citizen, Care 2, One Story, family, a physician family, Kevin MD, about my work with improved medical culture and just normalizing that doctors are not superhumans, that they're just like actual regular humans and that sometimes they need help because I think there's like this public opinion that physicians have to be flawless, and that's like obviously not the case. Physician of the Year 2016 by Medscape. So to be more technical, they have bizarrely a list of like worst physicians and a list of best physicians, and they didn't specify which one I was on. But yeah, I guess I was a physician of the year. They just weren't specific if I was the best or the worst. Now let's see. Oh, achieving life career goals despite adversity. Yeah, I've had some adversity. You know, it comes and goes. It's really hard for me to talk about sometimes because obviously it brings up bad memories and I mean, I guess the gist of it is that I was diagnosed with kidney cancer and then they fired me from the hospital where I was working. Um I there's so much more to it, but yeah, I would say that's adversity. And so I go and I talk about how medical trainees can navigate the system if they have some sort of disability. Like, surely I wasn't the only resident physician who's ever had cancer. So if we could like maybe get together and talk about the different things that we tried to do to get through it. Like, I mean, I applied for and was told I was granted FMLA leave, but I mean, that didn't help me at all. So, I have a internship program, as you guys may have seen from the previous photos. And one of the projects that we worked on was like trying to figure out the best way to go about medical training if you do have some life circumstance, like a disability or like if a loved one dies, it's like, what should you do? And the answer is not very straightforward. So we did a project about some of the options that exist, like EEOC, FMLA, and protections like that, because it's easier to know about it ahead of time than to be faced with a horrible tragedy and then try to figure out what to do. And you kind of just go through life assuming that if something bad like that happens, there'll be somebody to tell you what to do and help you. But unfortunately, I would say that that's most often not the case. Most often it's like you got to figure out what to do, which is really hard if, you have cancer. It's kind of consuming your time. Trying to figure out how to do FMLA paperwork on top of that by yourself is an additional obstacle. So if you're prepared, I mean, nobody thinks that they're going to get cancer and nobody like plans for these really awful things to happen, but it's good to do that. I mean, it's a hard thing to think about. Like, nobody wants to think about terrible tragedy happening to them, but it is good to at least have some idea of what to do if that does happen. So that's why I have my students look into like different protections, like legal protections and things like that. So yes, despite adversity, absolutely. Oh, mental health education. Yeah, I mean, that's my specialty there. Oh, tips and tricks from pre-med and medical students. So we have a lot of that. If any of you guys want to apply for the internship program, your friends Millie and Gitali, I'm sure could tell you how they did it, because whatever they did, obviously they were successful at it because I accepted them. So whatever they did, their tips are probably pretty good. So you can ask them. Yeah, so depression, addiction, stress, sexual assault. So we had a sexual assault prevention event. So every year we try to have one big project. And one year we put together a sexual assault prevention event, but it had a different focus. So usually if there's anything like that, it's the audience is not going to be the perpetrators, because like if you're a rapist, you're not going to go to an event about preventing sexual assault, right? But those are the people that really need the most education. I didn't want to have an event where I sit back and victim blame and be like, oh, well, here's how to not get assaulted. Don't go out at night and don't wear a short skirt. And like, no, like I didn't want to sit there and blame the victims. So even though I knew that the audience wasn't going to be who the presentation was really made for, I did it anyway. And it was basically focusing on how to not be a perpetrator. Like, and it's sort of like societal too. There was a focus on like how we as a society could change things to not foster such an environment that there's so many people running around committing sexual assault. And also I gave some advice to parents. I will edit it. The book is called How to Not Raise A-Holes. And it's basically like how to make sure your kids aren't racist, and make sure your kids don't assault people, and make sure your kids aren't bullies, and just make sure, oh, it's a pretty descriptive name, to make sure your kids aren't a-holes. And it's a great book, and it has a lot of evidence-based like it's based in psychology that has research on it. It's not just like somebody's opinion about how to raise like a great kid. It shows actual techniques that have some sort of psychological bearing and root in actual research. And then I discussed some other books too about like raising kids and making sure that your children are exposed to people of all sorts of ethnicities and cultures and religions and beliefs, because if you just have this one way of thinking, then when your kids encounter the people that are different from them, they people can get scared of people that are different from them and then treat them unfairly. So it was basically a talk about how to either you yourself not to go out and assault people, or to raise children that aren't going to assault people, or how we as a society can not make it so that the perpetrators get away with everything so easily. So I thought that was an interesting spin on the whole sexual assault talk, is that I've never heard of a talk that was designed for the perpetrators to listen to. So I mean, obviously I thought it was interesting because it was my idea, but I was tired of the same old, like, here's how to not get assaulted. It's like, okay, well, how about we stop people from assaulting people? Discrimination, again, like, man, the discrimination that I've seen is just so rampant. And, I and my colleagues and my students are trying our very best to end discrimination. But I mean, that's an undertaking. At least make it so people know that there are good people out there. Women's health issues. Yeah. Mainly I focus on women, people of reproductive potential. I could talk about women's health issues all day, but I think you guys want to hear more about like getting into medicine and that sort of thing. Lead pre-medicine. And suture clinics. Oh, that was fun. I always like that. Physical exam workshop. I teach physical exam skills. We use like the tuning fork and reflex hammer and stethoscope, and we do research. We're currently trying to get something published. It's in review for an article in a publication. So that's in the works, shadowing. If you engage in 20 hours or more of the internship, then you get to shadow me, which can be really fun. Medicine related assignments. So we do all sorts of topics like fatigue and COVID and night sweats and colds and antibiotics, and some of them are games, and because I don't like to just like talk at people, so I turn a lot of it into games. Oh yeah, we had over 50 interns. It was a good time. It was a great participation. All right, let's the next one, I think. Are we on slide 6? Oh, my research. I am blown away. If I read some of my old research now, I don't even think I'd be able to understand. It's like, man, my brain used to be so much bigger. Yeah, so I would some of this stuff is so technical. But okay, so the first one, the Merriam here is listed as neuroticism scores increase with late life cognitive decline, and that was published in the International Journal of Geriatric Psychiatry. I did this. I worked at the Memory Aging Clinic in the University of New South Wales in Sydney, Australia. So I got to chill on the beach while typing this paper. And interestingly, a lot of the papers that I had, I mean, these are like American journals, but I worked with people either in Australia or the United Kingdom. And it's hard enough typing things in American English, but I had to work with people that spelled things with the O, like color, like OUR, and the punctuation was different. So I just thought that that was interesting, like writing in another country because of so many different styles of writing. Oh yeah, I have this like hobby of actually it's also a fear too. Just like existential thinking. It's a little scary, but I wrote quite a long paper on the correlations between existential meaning and depressive symptoms. Um, it's kind of a downer. I don't know. It's not gonna, it's not an uplifting topic, but it is interesting. Oh, here's the just completely like immersed in physics. So I used to be a college physics tutor, and this is what I say, like, I look back at this stuff I wrote and I'm like, man, I used to be so smart because it's so technical and there's so much physics. And if you don't use it, you lose it. And I haven't really done much physics in 20 years. And so it's nice that I was at some point in my life able to do so much physics is all I'm saying. So this was the design and acceptability of the aviation laser exposure and self-assessment. So I called it Alyssa, and it was published in Aviation, Space, and Environmental Medicine. And during this, I got to do so much cool space stuff. I met Neil Armstrong. I met lots of astronauts, went to a lot of NASA meetings, and then went over to Europe and went to like an international space conferences and all. I mean, it was like space-tastic, which I love outer space, so it worked out pretty well for me. Oh, yeah, and here is the current one that it has to do with healthcare workers during COVID, which was a fresh topic. So the psychological impact on American healthcare workers during the COVID-19 pandemic, qualitative literature review. So this one includes some of my interns. So if you come and do an internship with me, get your name on a paper potentially, if you put the work in. We're not putting your name on there if you disappear halfway through. All right, so I was gonna say any questions, but there's only one slide left and it's filled with pictures, so let's go to that one. Ooh, look at that. We have a lot of fun too. There's a lot of teaching and a lot of fun. So, okay, so any of the things that I reviewed so far, anybody have any questions? Or heck, I'll answer any questions. I mean, I won't give medical advice. So if you have a rash and you want me to take a look, no, we're not doing that. But other stuff, I'm happy to answer your question. Are y'all muted or is nobody asking anything?
She did ask something. We probably just didn't project. She asked, what made you go into medicine?
Oh, whoa, we're going back to like the interview questions. Wow. I thought it was the most interesting out of I don't know, all the careers. So it was really between being a physician and being a theoretical physicist because as I said long ago, I was kind of obsessed with physics. Um I didn't think the job market was like real hot for like theoretical physicists. I mean, I'm really interested in like the big overall picture. I love science. That's always the cliche. It's like I love science and helping people. But yeah, I really genuinely truly enjoyed everything that had to do with science and working in the hospitals, and I couldn't really see myself doing anything else. But there's still time for me to be a theoretical physicist. Yes, I think I saw a hand, but I didn't hear anything, and it's probably because some kind of technical issue.
He didn't speak yet, that's why.
Oh, well, okay, please go ahead.
My question is, how do you balance a career in medicine and motherhood at the same time?
Can
Were you able to
somebody?
Waggel?
No. Mike, I heard
Um,
my question is, how are you able to something at the same time?
Were you able to balance a career in medicine and motherhood at the same time?
Oh my gosh, it's so hard. Who said I was? No, just kidding. Woo. Okay, so I will say it's got to be the fact that I work for myself. I don't know how people in like can I even call it like corporate medicine? In the hospital system do anything because when I worked for the hospital, and this is not going to turn into me just griping, but when I worked for the hospital, I mean, they forced me to work over 120 hours in 1 week. I literally don't know. I think there's only 163 hours in the week to begin with, and I mean, I that's all I did. I basically lived there. That's why we're called residents, is because you reside at the hospital. I truly don't know how I knew one resident and she was pregnant and she could like barely walk and she just asked if she could take like a chair to sit down during rounds and they told her no. So I hope that that has changed and I would think that they're a little bit more friendly towards being a mom and being a doctor nowadays, but man, back in my day, like, I don't think I could have been a mom and a doctor. I mean, obviously people do it. I think you should probably be an attending first. I just don't know how they there there are residency programs that will pay for you to freeze your eggs just because they do not want you to get pregnant during residency. And again, I'm not turning this into just Dr. Waggle sits and complains. It I think, and I don't know, it's correct. I think that maybe they're making it easier. There was an article that I just read, and it was basically saying that young doctors are looking for a work-life balance, and old doctors are saying that's just not possible. And so now there is a debate and it's younger doctors are like, what gives? Like, I need to have my own life. And the older doctors, there's this mentality that the older doctors have. It's like because they went through this horrible, like abusive training process, that every subsequent generation also has to do it. Because some people are of the mindset, like, if they suffer, everyone else around them needs to suffer. And I'm not saying that I'm like a saint or anything, but I think that if I suffered, other people shouldn't suffer. Like, but hey, I wouldn't quite put myself as an old doctor, but I'm not a young doctor either. So I feel like I'm in the middle. It's like I went through like really abusive medical training and I don't want other people to have to deal with that. But the doctors, I'm not saying all of them. I'm just saying like a generalization that older doctors have this mentality that they had to do all this really hard stuff. Let me put it to you like if you're taking a class and you it's like Hermione Granger at the end when they canceled all the exams, basically, is you're taking a class and you work really hard. You work your butt off, you're studying, you don't go to your own sister's wedding because you have a final project, you're doing all this work. And then on the last day, the teacher's like, oh, by the way, everybody just gets an A. Like, so in that, it's not fair because you worked so hard and then everybody gets an A. So that's kind of where they're coming from. The older doctors that are like, oh my gosh, I worked so hard for years and you should too. So it's not all that they're trying to be malicious or anything. It's more like they just feel that you need to do this it's a rite of passage sort of thing. But I have a sneaking suspicion that this may not be the case if and when you guys go to medical school. I'm assuming you all want to go to medical school. I think that it's getting better and I mean, your generation has the power to change things, and I don't think you guys are going to stand for working 120 hours. Now, I will say that there are these rules by these governing bodies saying that you're not supposed to work 80 hours or more. But the problem with that is that if you report that you're working more than 80 hours, they'll put your program on probation, and then that just is bad for you because then you don't graduate from an accredited program. So it's incentivized, like turning your program in is bad for you. So who's going to report that they're working 120 hours? Like nobody. But I strongly believe that you guys will change that and you'll be working a mere 90 hours instead of 120. So there was a long-winded answer to how to be a doctor and a mom. And my answer is own your own private practice. That way you don't have to work 100 hours a week, but that's not feasible. I mean, there's a lot of specialties, especially surgical specialties, where you have to work in a hospital, unless of course, like you can get your own like outpatient surgery center or something like that. But being able to set your own hours is really important. And now this is just, I don't want to sound too cynical, but I suspect that the powers that be purposefully don't incorporate any sort of financial or business training into medical education because they want you to just kind of be a cog in the wheel and listen to what the business people tell you. But I think it's really important to learn the business side of medicine so that you can be your own boss, so that you can come home to your kids at night. And of course, it's important to be able to spend time with your kids. So that's one factor. But another thing is like physically being pregnant makes it hard to do any regular activity. Like, first of all, you're like peeing every 20 minutes. And it's just, oh my gosh, breastfeeding. Does anybody want to take a guess at how many hours a week, depending, some people just feeding your kid, like even if it's bottle feeding, like how much time do you think you should allot for that? Well, the answer is 40 hours. It's a full-time job. So spending time with your kids is great, but you also have to, if you're the person who is having the baby, factor in like that resident who barely could walk and they wouldn't let her have a chair when rounding at the hospital. So to be a mom and be a doctor, I think you need to stand up for yourself and all work together for your generation. And if I could somehow send out like that article about how the new doctors are really working towards a work-life balance and the old doctors are like, no, you're not allowed to do that. I think that would be an interesting and helpful article for you guys to read. But it can be done because here I sit being a doctor and a mom. So obviously it is possible. And I'm in a physician moms group and there's like 80,000. So there's at least 80,000 of us doing it. It's not easy, but it is possible. Any other questions?
Yeah, me and Millie have one. If you're not sick of all the questions from the summer. So what made you choose perinatal psychopharmacology specifically as your subspecialty?
Well, that's great, and that kind of ties into this whole being a mom and a doctor thing. So I didn't choose that until after I was a mom, and I realized when you become pregnant, no one. Okay, hold on. I'm not going to talk in extremes. Very few healthcare providers will help you because they're afraid of the liability. I'm sure you guys have seen everything that was like consult a doctor if you're pregnant and you ask your doctor and their default answer is just don't do it. Because if they say you're allowed to do it and then something happens to the baby, then they're liable for it. And it's like, what, is there nobody out there that is like willing to prescribe medications? Of course you have your OB, but they're not trained, and I think most OBs do not enjoy. Well, I'm sure there are OBs that enjoy doing psychiatric care. I just haven't met very many of them. And so in general, I would say that OBs don't like being psychiatrists too, or else they would have gone into psychiatry. And so actually that's true for a lot of specialties. I find is that a lot of my doctor friends in other specialties are like, ugh, psych, like that's the worst. And so if you are pregnant and you go to your OB for like mental health help, unfortunately, you might not get it. Again, there are tons of great OBs out there. I'm not sitting here and saying that they're all bad and they don't know anything about psychiatry. I'm just saying that statistically speaking, it may be hard to find that OB that loves doing psychiatry too. And so there is certainly a need for women who are pregnant and postpartum, or women who are considering becoming pregnant, to have somebody care for their mental health needs instead of the default, which is mental health providers finding out that you're pregnant and saying, oh my gosh, stop all your medications at once. I can't be liable for anything that happens. So yeah, so basically, I became pregnant and realized that this is a humongous gap in healthcare and it needs to be filled, and me fill it. So here I am. Good question.
Questions?
I have a question just for like other people that like haven't done the internship like me, Millie, and Molly. So
Is
like,
that Carter?
Yeah, that's Carter.
He's so tiny on my screen. Huh?
what are some benefits that people can gain from joining the internship both fall and summer?
Oh gosh, the benefits. Okay, well, as I said before, you could get your name on a paper. That looks really cool. You get to spend time with me and you get to hear all my really funny jokes. And then so again, I tried, and I don't want to discourage anybody from going into medicine. And I have to reiterate that I'm pretty sure that it is way better than it was back in the day. But one of the benefits is that I'm going to tell you straight up, like, no nonsense, like things that you may not expect or that they don't teach like mainstream, like shadowing doctors. I keep it real, so you're gonna hear like real inside stuff. I also teach like the lingo, like sequelae and like things that we say working in the hospital, like that if you say or use the terms correctly, you look like you have experience in the healthcare field, and you don't just come in as a noob and like say something really silly and then people are like, you don't know what you're talking about. So I'll teach the lingo and I'll teach you like how things work practically, and I don't sugarcoat stuff, and I'll tell you how it actually is. So you'll learn more than just, obviously I teach science and anatomy and physiology and all that stuff, but you can learn that anywhere. I mean, it won't be as entertaining as learning it from me, but I also go into practical things and like experiences and how to deal with like working with difficult people and just stuff that you typically wouldn't get from just like shadowing a doctor. So, keeping it real information, journal club. I didn't think we did that over the summer, but in years past we used to have journal club, which was really fun. It's something that's done in medical training where like you take a journal art. It's like a book club only with journal articles. And I think it's really fun. If you're a nerd, you might like it. So we do that. And then you get to shadow me. I mean, you can actually have real patient interactions, which when you go to your interview, it's probably good to have like some experience of interacting with a patient at some point. And then I give and what in my opinion is like really good advice. One of my favorite pieces of advice is preparing for your interviews. They can ask you like pretty much anything. So it's good to have like anecdotes of specific experiences that stand out in your mind that you have familiarized yourself, like maybe like 5 experiences working at the hospital that stick out so that you can use them as stories whenever somebody asks you something. And so you're not just sitting there during an interview like the hamster is like running and you don't know how to answer the question. And so that's one of my favorite pieces of advice, is to just write down 5 stories ahead of time. That way, whatever is most pertinent to the question, like you can go right to it without having like a giant gap where they're like, hello, are you there? So the internship, I give a lot of like pre-med advice and interviews. And also, if you keep your hour log and you don't lose it, I will write you a letter of recommendation and use all the things that you put on your log, which a lot of times people get letters of recommendation that are really generic, but I make them very specialized because I incorporate everything that you put in your log into your letter. And also being on the other side of that, reading letters of recommendation, like we can tell if we're reading a letter of recommendation and it's just generic and the letter writer didn't know anything about the student. And mine are not that. My letters of recommendation are really good and very specific and have like a lot of examples. So I think getting a letter is probably pretty big perk of the internship.
Thank you.
Yeah.
Any other questions? We probably have time for like one more.
You guys have been a wonderful audience. Now, again, I have to point out that I love being a doctor, and if I had a time machine, I would not go back and change anything. I wouldn't even change the whole cancer getting fired thing because, well, first of all, I have like this philosophy of the butterfly effect. If you change one thing, who knows how many other things it would change. But honestly, like not having to work for a hospital is, like I said before, what enabled me to like be a mom and actually see my kids once in a while. So at the time where I thought getting fired from the hospital was like the end of the world, it worked out for me. So I wouldn't be anything else, even the theoretical physicists, although that could be a hobby of mine later on in life. I would do it all over again. I absolutely love being a doctor, and I wouldn't change anything. Oh, thank you. Thank you. All right. Should I just like press end or like, is there some outro? Like, oh wait, was there like, wait,
Yeah.
pictures of me from, are there more? Is there more of slides? Oh, yeah, I guess there were.
I was just gonna go to the last one with your contact information on it to end off.
Oh wait, you don't want to do this is me from you guys don't even know what MySpace is. That's another thing with a lot of my like students and interns. Like I have these like jokes because I'm a millennial and they're like, I don't get them. Does anybody know what MySpace is?
People are nodding.
Nodding yes or nodding no?
Nodding yes.
Oh, okay. See, all right. So yeah, I have a lot of millennial jokes and you just like have to pretend and laugh. Oh wait, did Miriam put a little video in here? I'm interested. What is going on?
Yeah, I guess she did.
Oh yeah, this is oh man. Okay, you can go ahead and play it. Miriam filmed it.
Follow Dr. Waggel around for a day in the life of a psychiatrist. Here she is getting out of her Tesla with her red bottom. She's so cute. And yes, she put on her coat in the parking lot. We're a psychiatry clinic located in Reston, Virginia. She's the medical director and the founder for the clinic. Had a super busy day ahead, so we headed straight inside. And of course, Dr. Waggel drinks like 3 cups of coffee a day, so she had to make a cup before we headed upstairs. Here is the waiting room. And then we headed upstairs. This is Dr. Waggel's office. She is in the office every Wednesday. We do both virtual and in-person appointments. Right at 9 a.m., we had to jump into a Zoom session with the new summer 2023 interns. They had pre-medicine questions for Dr. Waggel. After that, Dr. Waggel jumped into her telesession. She had back-to-back appointments. And then we set up for 2 of our patients to get their TOVA test done. A TOVA test is a computerized ADHD test. The test can take the patient up to 30 minutes to complete, which can be a better alternative to those 7 to 8 hour long ADHD tests. And here's me grabbing the earbuds for patients to use due to outside noise or distractions. And around 5 p.m., we were finally done for the day. See you later.
Yeah, and then if you open up your own practice, you get to have an office manager to do cool stuff like that. All right, I can hardly see anybody, but I'm assuming everybody's good to go. We've answered questions. I get to go put my kids to bed. Am I safe to, I'm gonna say hang up. That's a thing that only millennials say. You guys don't know about back in the day when you actually had to put your phone on a receiver. Can I say hang up? Is that still a thing? Wow, I'm like sounding like the oldest person on earth right now.
But yeah, you're good to go, Dr. Waggel. Thank you so much for coming out and talking with us. We always love and appreciate hearing your insight. And I hope you have a good rest of your night.
I'm so happy to see you guys again. I've missed you. Take care.
You
Thank you
too.
so
Bye, Dr.
much. Bye,
Waggel.
Dr. Waggel.
Bye.
Okay. Well, thank you all for coming to this.